Adolescence is a roller coaster of emotion, but for some adolescents it's made harder by a life-threatening battle with anorexia nervosa, a severe eating disorder with the highest mortality rate of any mental health condition. It's not just about food, it's a complex trouble with psychological, emotional, and social consequences. Now imagine this. After weeks of intense clinical treatment, a teenager is discharged with no immediate follow-up care. The data are very worrying. In fact, 27.9% of girls and 12.1% of boys suffer of that. Also, they are left waiting, sometimes for months, for outpatient therapy. It's no surprise that relapse rate can reach 50%. Families, meanwhile, are desperate to help, but often lacking the tools or knowledge to support recovery. That's where the Computer Center for Intervention and Emergency Assistance, or CIS, steps in. We provide flexible, personalized support during this critical gap, ensuring adolescents to stay on track. At the same time, we empower family to be part of the solution.
After this brief introduction, the presentation of the problem follows, forming the basis for their conceptual solution. The emergence and the progression of anorexia nervosa, as well as the success of therapeutic measures, are significantly influenced by individual and social factors. Considering the individual level first, the family situation is particularly central as it encompasses not only protective but also risk factors. Risk factors include dysfunctional relationship within the family, excessive parental control, high performance pressure, poverty, and a lack of social support. Additionally, relatives often experience insufficient knowledge and are overwhelmed by taking care of a young person suffering from anorexia nervosa. When viewing the macro level, structural deficits within the already rigid and overburdened German healthcare system represent a major obstacle to effective treatment. Despite the high prevalence of eating disorders among adolescents, affecting around 20% of 11 to 70-year-olds, and a high relapse rate of 30 to 50% after inpatient stays, there is a lack of flexible and immediately available services. After clinical treatment, the waiting time for an outpatient therapy slot often spans several months. These delays not only jeopardize the recovery process and overall chances of healing, but also increases the risk of relapse. But how could a conceptual solution to this problem look like? One possible approach is offered by the S3 guideline for the diagnosis and treatment of eating disorders, which emphasizes the seamless transition between inpatient and outpatient care. And this is precisely where our concept CIS comes into play.
To address the critical gap between inpatient and outpatient therapy for anorexic adolescents, we develop a strategic plan using the business model canvas. Our success depends on partnership with schools, clinics, and health welfare offices for referrals. Local foods retailers support healthy eating programs. Municipalities and health insurance funds provide essential financial resources, while donors and sponsorship help to sustain our operations. We offer a flexible outpatient group and individual therapy, family counseling, and resource-oriented social and creative activities like cooking workshops and sports, ensuring adolescents stay engaged with the recovery. Our core resources include not only a peer community, but also a multidisciplinary team of therapists, social workers, and nutritionists. We have well-equipped facilities with group rooms, kitchens, and administrative spaces. Financial resources come from subsidies, insurance contribution, and donation. Our mission is clear: prevent relapses by keeping adolescents motivated during the therapy gaps. For families, we offer support to reduce stress. For healthcare system, we alleviate pressure, improving long-term recovery outcomes. We connect with users through website, flyers, social media, and direct clinic referrals. Our relationships are personal and empathetic for users, while professional and transparent for funders, ensuring trust and clear communication on both sides. We have developed a 3-year financial projection to ensure the sustainability and growth of CIS. In the first year, we anticipate serving around 30 clients, with total expenses around 285,000 euros. This includes personnel costs, rent, and materials. Through subsidies, we project a surplus of 13,000. By year third, with strategic staff expansion, a second therapist, and additional social worker, we can increase capacity to 50 clients, with a surplus around 100,000 euros. We chose a GmbH, the German structure for limited liability. Unlike non-profit status, this allows profit distribution for reinvestment or employee incentives, while stay true to our social mission.
To discuss the results of the CIS project, 4 approaches have been identified. The timely approach, because long waiting times for therapy placements often lead to the deterioration of individuals' health during the waiting period. The sustainable approach, our proposal offers effective support during the waiting period, ensuring that individuals do not regress before formal therapy begins. The holistic approach, stabilizing individuals before therapy and maintaining their motivation, help closing systemic gaps in healthcare and improves long-term outcomes. Finally, the multidisciplinary approach. Eating disorders are complex and require collaborative treatment. Integrating interdisciplinary care enhance therapy success and reduce relapse rates. Together, this approach highlights the effectiveness of CIS model. The future expansion of CIS beyond Germany into the European Union present an opportunity to address care gaps in adolescent mental health on a broader scale. However, there are some key challenges, for example, cultural and language diversity across Europe that may hinder effective communication and limit the acceptance of CIS approach, requiring customization that could compromise scalability. And then sustaining consistent quality while navigating complex legal, financial, and cultural landscape. Despite these challenges, CIS evidence-based and holistic approach has strong potential for scalability. By addressing barriers, CIS can become a benchmark for adolescent mental health across European Union.